we saw the 360 videos approach that was presented by our previous two colleagues here in NAUF. We created 3 RLOs using cardboard and desktop applications. This is about hands-on cardiography and basic diagnostics. We specifically chose the placement of electrodes, the correct placement of electrodes as a clinical skill, as well as the identification of common patterns in electrocardiogram and some basic radiology knowledge. Now, regarding the core clinical skill, our focus was ECG electrode placement. Both skills selected are ubiquitously useful. They're cross-disciplinary skills, and in some countries they're interchangeable between nurses and doctors. And even though it is easily taught in hospitals, errors can incur delays in primary care workflows, so the port to virtual reality is both straightforward and useful. Now, before going into the details of a demo that I'll show you in a while, the approach that we have in the tutorial for electrocardiography placement was a straightforward linear approach, as is the process itself. There are appropriate instruments to be used and are highlighted in tutorial mode. There is also an examination mode where the users have to follow the process without help. We have to use all the items in the workbench in the correct order, placing them on the patient by clicking on interactable surface. Instructions are presented in an overhead screen, you'll see in a while. We have used, and you'll see in the application, an XR approach even in the desktop application. We wanted to keep the control scheme similar. We use a standard WAST control scheme in the desktop. Now, before going to the application, you can scan this QR code to try and download the desktop resource. This is a repository on, I think it's on OneDrive, I'm not sure. If you have an Android device, you can download it from the Google Play Store here, and it works only with headsets. It's twin view, it's not purely mobile, it's not implemented. Bear in mind that this works only for the English, for the UK, Greek and Cyprus store. If you want to have a look at the resource and you're not in these countries, you can use this QR resource in order to be able to download it as an APK, but then you have to enable your device to trust the application, because it's an executable APK for Android, and most devices don't certify that. Before moving on to what we have on evaluation, I'll try to give you a small demo of the application itself to see what it's all about, what we have created. Let me see if I can share my screen in a different way now. Is the application useful? Can you see a viewport moving?
Yes. Okay,
thank you so much. As you can see, this is a rather minimalistic environment. It's directly ported from VR, so in our case, from mixed reality. So in our case, this would be a camera view, so that's the white background for you. We have the electrocardiogram interactive scenario. We take our instructions from the panels, and we have to apply every instruction in sequence. I'm not sure if there is sound in your computers.
No, there is no sound.
There are some, I'll narrate then, there are some sounds to help identify positive or negative actions on your behalf. As we can see, we have a color coding to demonstrate where you have to place the specific instruments of ECG. And then we have to use color coding to actually find the correct place to embed the chest electrodes. In the application that exists in the Google Play Store, we have overlaid a skeleton of the human body under the model in order to be able to identify the correct placement of the first electrode as it is taught as a clinical skill. Here we don't have it, and that's why we're highlighting the approximate position of the electrodes. And that about concludes this clinical exercise and brings everyone to the exit. Let me just quickly stop sharing my screen before continuing. What we'd like to suggest at this moment would be to use these QR codes for both our resource, and afterwards I'm sure that both Stathis and Photos will mention their own resources, but especially use the QR code here on the bottom right to evaluate, use the resources, use them on your phones, and then tell us what you think about usability. How do you find them accessible to your device, technical issues, pedagogical issues. We have developed both usability as instrument and the technology acceptance instrument with some free-form